Motivational Dentist, and today we're just going to be talking about cavity. How do they form? Where do they come from? Do they just magically appear on your teeth and cause brown stain? Is it something that you're doing that is causing all of your teeth to rot and fall out of your mouth? And is it something that you can be doing to prevent having toothaches and prevent having all this expensive dental care treatment and saving time and money by simply knowing what a cavity is and knowing how to prevent it? So a cavity is basically, in layman's terms, a hole in your tooth. It is a spot on the tooth that has cavitated, like a pit. A cavity is basically, in layman's terms, a hole in your tooth. It is a spot on the tooth that has cavitated, like a pit. The bacteria has sat there long enough to cause a breakdown in your enamel, which is actually the hardest substance in your body. It has sat there long enough to ferment the food that you eat and, deliver all type of toxins onto your tooth surface. In the dental field, cavities are called dental caries. Sounds like a pretty word, but they're not very pretty. It's not very pretty when you get a cavity. And the quickest way to treat a cavity is by going to the dentist, where you can get anesthesia. We can numb you up and fill your tooth with a more solid material other than the soft cavitated lesion, because if that lesion stays there, it's going to start to get bigger and bigger and bigger. A whole another set of problems. This is going to bring about root canals when the cavity gets so deep that it gets in contact with your tooth nerve. This is when you start to feel that pain. A lot of people don't know that they have cavities. A lot of cavities form on the interproximal area in between the two teeth, and a lot of cavities form in areas that you miss with brushing. They like playing hide and go seek. You have to learn to cherish your smile. You have to learn what is gonna damage your teeth, because you won't realize that you miss your teeth until they're gone. Then it's too late. So my goal with Motivational Dentistry is just to encourage you to be familiar with these terms, to really get to know your dentist, and to take your smile and your teeth serious, and always to treat your teeth like angels. You don't want to have a cavity. You don't want to let bacteria just sit on your tooth and cause all types of plaque. And plaque is just something that is sticky. It's a slimy substance made mostly of germs, and these germs cause tooth decay. Okay? They cause tooth decay and all types of problems. When people go to the dentist, they always wonder, that's the first thing that they wonder, do I have a cavity? But most of the time, people let it go so far, because cavities they don't start hurting until they get so bad. And you can get some sensitivity and stuff like that, but they don't start hurting until they reach that nerve, and then it's like, oh, do I have a cavity? And you come in and you got like 10 cavities. Not good. So we want to start being aware of caries or cavities, and making sure that we're brushing twice a day, making sure that we're flossing every day, making sure that we're going to the dentist and getting our teeth cleaned professionally, at least once or twice a year. Definitely twice a year is the recommendation, but you got to do what you can. I understand that dentistry can be expensive, so you got to do what you can, but you definitely want to fix your cavity as soon as possible. If you don't go to the dentist as soon as possible, the acids that are fermented from the bacteria can continue to destroy your enamel. Okay? It can destroy your enamel, and then it goes into the dentin, which is the next layer of the tooth, and then after that is, over. You got toothache and expensive root canal. So if you ever had a root canal, or if you ever had a toothache, this goes all the way inside of your tooth, touches your nerve. I've never had a toothache, but I can tell you that they make grown men cry. They make grown women cry, and they will definitely make a child cry. So people compare them to giving birth. I doubt it's that bad, but you just never know what people's pain threshold is. So you don't want to test that. If you do go to the dentist for a toothache, What's going to happen is we're going to take an x-ray to figure out where your cavitated lesion is and figure out what processes we need to do to repair that. If it's in the posterior, is it between two teeth? How many teeth are affected? Is it treatable? Sometimes these cavities get so bad that you have to lose your teeth. We don't make new teeth, so you got to get fake teeth. You have to get false teeth, or you have to get some type of implant, and these things are expensive, so you want to try to avoid them. If you go to the dentist for a cavity, when you come in, we'll take x-rays, figure out what the problem is, and treat you if possible. It might be an extraction, you might need an emergency root canal, you could need a crown, you can need a whole bunch of stuff, so I can't really say what you'll need via the video. But that's how you would diagnose that. But chances are, if you haven't been to the dentist in a while, you might have a few cavities. So go get your cavities checked, get your holes filled, and don't let pain haunt you. Okay? So this is my first vlog for Motivational Dentistry, really talking about these type of subjects. I want to keep it going. Please subscribe to this channel. Please leave your comments and questions about things that you have in dentistry that might help you take better care of your teeth and treat your teeth like angels. So I look forward to chatting with you again. Don't forget to hit the subscribe button, and I'm out. This is your motivational dentist, Dr. Shon. Brush twice a day and floss. Okay? Keep the cavities away. Capiche?